everyone, so in this video we will present one of the pharmaceutical issues that are currently being discussed and are certainly very interesting for us to discuss. It's called IoT at pharmacy. At this time, we take the topic of a case study on smart pill dispensers and remote patient monitoring. Wow, sounds cool, right? Okay, previously introduced us from Class C, Faculty of Pharmacy, Ananda University. My name is Esperanza Putri Twelvejune, and my friend Debby, Ananda, Hanny, and also Zhahira, Alya, Siffa, Yuniar. Okay, without any further ado, let's get it. Firstly, I wanna ask you guys something. Did you guys know what is IoT? So, IoT is an abbreviation for the Internet of Things, and it refers to a network of physical devices such as sensors, machines, appliances, and other embedded systems that are connected to the Internet. These devices collect and exchange data in real time without requiring human intervention. IoT plays a transformative role in healthcare and pharmacy by enabling smarter, data-driven, and patient-centric solutions. Its relevance includes, number 1, remote patient monitoring or RPM, which is wearable devices and connected sensors can monitor vital signs, it allowing doctors to track patients' health in real time. Number 2, smart medication management. It can notify caregivers or physicians if a dose is missed, improving adherence and reducing errors. Number 3, asset tracking in pharmacies or hospitals. These IoT systems can help manage inventory, monitor drug storage conditions. Number 4, chronic disease management. IoT devices assist in the continuous management of long-term conditions like diabetes, hypertension, and heart disease, enabling personalized and proactive care. And the last one, number 5, data integration and analytics. Real-time health data collected from IoT devices can be stored in closed system for analysis. Okay, now let's talk about its history. The concept of IoT emerged in 1999, but its application in healthcare and pharmacy began gaining traction in the 2010s with the rise of affordable sensors, wireless technologies, and cloud computing. And then, in 2021, IoT with advanced analytics became prominent in healthcare and advanced manufacturing. IoT security became a top priority among vendors. Initially used for inventory tracking and supply chain monitoring, IoT has evolved to enable patient-centered care, especially in medication management.
Mrs. R was assessed after a referral from her social worker. She had received a brain injury a few years earlier, which had left her with memory loss and epilepsy. Her quality of life had declined because her husband had to work away, which meant she was forgetting to take doses of her medication and had to rely on her children to remind her to take her tablets. Because she was forgetting her medication, she was suffering more epileptic seizures, which made her feel very self-conscious and not wanting to go out and accompany. After using the pill dispenser for a couple of weeks later, she was very happy with it and she was taking her medication much more reliably. This meant her seizures were now improving, giving her much more self-confidence, improving her quality of life, and giving her husband much more peace of mind whilst working away. The next is case study according to journal. For the first, the elderly population is increasing globally, which results in a higher demand for daily medications. According to a 2021 report by IQVIA, the global medicine market is projected to reach $1.6 trillion by 2025, reflecting this growing demand. The second, the issue of polypharmacy, where individuals take multiple medications to treat various chronic conditions, has become widespread among older adults. Studies cited in the case study reveal that over half of adults aged 65 and older take 4 or more prescription medications, with some taking 10 or more. This increases the risk of adverse drug reaction or ADRS and complication due to drug interaction or mismanagement. Break down the tasks and allocate resources effectively. And the last, conventional and semi-automatic pill box require users or caregiver to manually organize medications, which is not only labor-intensive but also unreliable, especially for elderly patients with cognitive decline, impaired vision, or limited motor skills. The COVID-19 pandemic further highlighted the difficulty of safely managing medication in disconnected healthcare settings. We have solutions for previous case studies like 1. Remote dosage control. 2. large format touchscreen and user-friendly interface. 3. Smart study mechanism. 4. Cloud connectivity and real-time confirmation, notification, and reporting. We also have the outcomes of the case study, such as improved medication adherence. Patients, like Mrs. R, have shown increased reliability in taking their medication, leading to better management of conditions such as epilepsy. Enhanced quality of life. By reducing the frequency of seizures and providing patients with greater independence, the dispenser contributes to an improved quality of life. Peace of mind for caregivers. Family members and caregivers experience reduced stress, knowing that the patient medication regimen is being followed accurately. Cost-effective healthcare. By preventing medication errors and hospital readmissions, the dispenser helps in reducing overall healthcare costs. Okay, for the last case study 1, smart pills dispensers, we have advantage, potential drawbacks, and ethical and legal considerations. For the advantage, we have improved medication adherence, remote monitoring and control, enhanced safety and independence, data collection for healthcare insight. For potential drawbacks, we have cost accessibility, data privacy and security risks, technical challenges. And for the last is ethical and legal considerations, informed consent, data security, equity of access, and regulatory compliance.
The Hackensack Alliance Accountable Care Organization, or ACO, in New Jersey serves approximately 40,000 patients, many of whom are elderly and managing chronic conditions like heart failure. To address high hospital readmissions rates, the ACO implemented a remote patient monitoring program utilizing Health Recovery Solution, or HRS technology. Technology implementation: patients receive a 4G-enabled tablet preloaded with educational content and integrated with Bluetooth medical device, including blood pressure tube, pulse oximeters, and glucometers. These tools allowed for real-time monitoring of vital signs and facilitate daily health surveys. Nurse navigators oversaw patient data through a dedicated web portal, enabling timely intervention when necessary. How it works: remote patient monitoring leverages Internet of Things, or IoT technology to collect and transmit patient health data from home to healthcare providers. Devices such as wearable sensor and connected medical tools gather information like heart rate, blood pressure, and glucose levels. This data sent via secure networks to healthcare professionals who can monitor patients' conditions in real time and provide timely interventions. Outcomes: reduce readmissions, enhance patient engagement, improve quality of life. Advantage: continuous monitoring, patient empowerment, resource optimization, cost savings, accessibility. Potential drawbacks: initial costs, data privacy concerns, technology adaptation, integration challenge. Ethical and legal consideration: informed consent, data security, equity of access, regulatory compliance.
So, now we know that IoT is changing pharmacy by improving how patients manage medication and chronic conditions. Smart pill dispensers help with timely medication use, while remote monitoring reduces hospital readmissions. However, challenges include high device costs, limited access, data privacy concerns, and ethical issues about data control and usage. Our team have recommendations for the future of IoT in pharmacy. Number 1, make it more affordable and available. Number 2, protect patient data. Number 3, connect everything. Number 4, teach people how to use it. And the last one, make it fair for everyone. These are the references that we use in this presentation. Okay, that's all our presentation about IoT in the field of pharmacy and healthcare. Thank you for your attention and goodbye.